Hello, everyone. I'm Jen Rombalski, the director of the Crosse County Health Department and the health officer for Crosse County. I am coming to you today in this emergency media briefing to talk about a couple of things, predominantly the Supreme Court's order and the decision that they made and how that may impact us in Crosse County. Also, I would like to weave in an update about the current cases in Crosse County as we have had additional activity. And I will give you an update on the testing application to the National Guard for a testing site late next week. So to start with, I just want to let you all know that this is really a time of great change. And while I think there may be mixed emotions in our residents and our businesses and our communities in Crosse County and surrounding counties in relation to the Supreme Court decision. This is a time where we can unite together, and we need to remember that we are in a fight against a virus and not each other. So first and foremost, to let you know, if you are not aware, that the Supreme Court did make a ruling yesterday, which immediately made the safer at home order basically unenforceable. And so that means that the order is no longer in action that basically enforces or allows for enforcement of all of the activities and requirements under that order. I would say that despite the fact that that order is no longer in place and enforceable, we know what we need to do here in Crosse County and surrounding counties, and that order should not change, and that decision by the Supreme Court really should not change what we do and the path that we continue forward on. I will lay out for you today a number of things to include some of the data that we look at to help us make decisions about when we are ready, as well as I'll talk about one key data or one key gap that the data shows us, and that is specifically in the area of testing. And then I will lay out the recommended actions that I have and will continue to ask our residents and business owners and others to take to protect ourselves and each other here in Crosse County. So we know that we are not ready yet to be fully open. So despite whatever the order does or does not allow us to do or enforce us to do, we are not ready. And we know that because we see that in the data. So a complete return to functions prior to COVID-19 will definitely increase our cases and will very highly likely result in severe disease, including hospitalizations, and also very possibly deaths of our county residents. So I think it is important to know that what we do or do not do in terms of our own actions and behaviors will impact others. I want to now talk a little bit about some of the data that we look at, and this data is for Crosse County. We also have it available regionally. The state has, as you know, a Badger Bounce Back plan that has some metrics in it. It talks about, it calls them gating criteria, and there's a dashboard that you can find on the state's website, the Department of Health Services website. And that dashboard shows specifically that we have not yet met the criteria around a downward trajectory of influenza-like illness reported within a 14-day period. When we look at Crosse County, we first start with the fact that we have a strategy here in Crosse County, and that strategy has an overall goal of decreasing death and decreasing disease and associated effects of disease from COVID-19. It's a simple strategy, but the solution and the actions to that are not always as simple. We have talked about our strategy before, but we have 3 primary objectives underneath that strategy, and it follows the primary prevention, secondary prevention, and tertiary prevention. And what that means is, in primary prevention, it is about doing all that we can to prevent any cases in the first place. Secondary prevention is, if we get cases, how do we very quickly connect with those individuals to determine their contacts and reduce the spread of disease. And tertiary prevention really relates to if someone does develop severe disease, then it is utilizing our healthcare partners in particular to do our best to try to decrease the severity, the length of time that someone is sick, and the potential that that person may die from COVID-19. So that really is the strategy. And there are, of course, details within the strategy that I won't go over at this time, but I want you to know that we have a strategy, and many of you have heard me talk about that strategy before. So when we look at meeting the goals in that strategy, we have been tracking data specific to 3 separate categories. And the first category is what we call epidemiology. And really what that means is it tells us what the virus is doing. So that is things like our case numbers, the percentage of positive cases out of the total number of tests that have been completed, the doubling time, or how quickly we double our number of cases over time, and also our total testing level. We also look at public health capacity. We have goals in our department around the time that it takes to get the case initially. So how long does it take for us to get that case, that notification of a case from the lab that is running the test? How long does it take for us to contact and do the first interview with the actual case that has a lab that is lab confirmed for COVID-19? Our goal is within 24 hours for that. And then we also have goals around how quickly can we connect with the contacts of a case. And you can imagine that can be a challenging goal to meet. Some individuals who have not been out and about in the community have very few contacts, and we can do that really quickly. Others, if they have been out and about in the community and have additional contacts, they have been having folks come and visit them, or they've hung out with other individuals, they can have lots of contacts, upwards of 20 or more. And that takes a lot of staff time and energy to make sure that we can reach all of those contacts, identify their symptoms and their risk levels, and appropriately advise them about what to do in order to decrease the spread of disease to others. This particular virus can spread quickly with that increased number of contacts. And I think that's an important thing to know when I get to the latter part of my talk here today, which is when I make asks. And we make these asks based upon data and based upon what we know about how the virus spreads. The third category that we look at in the data is on the healthcare side. Our healthcare partners are critical partners, and we need to make sure that they are ready for a surge. So if we had a significant number of individuals, particularly at one time and not spread out over time, that would require higher levels of care because they are experiencing severe disease, to include requiring ICU beds or intensive care unit beds, ventilators, and other things. We want to make sure that our healthcare partners are ready, not just with the number of beds and the ventilators, but also the staffing levels and the personal protective equipment to be able to provide that level of care, particularly if it needs to be over an extended period of time. So those are the 3 categories: epidemiology, public health capacity, and healthcare capacity that we look at in order to determine where we're at in readiness. So I'm going to take you through just the epidemiology side of this data, and I want to help you understand what particular metrics we are looking at and where we're at with each of those metrics. So this data is up to date as of yesterday, May 13th. There are 4 metrics that we look at in the epidemiology category of data. The first one is to observe a 10% decrease in the number of new cases, comparing the recent 2-week period to the previous 2-week period. So here's where my case update comes into play. Earlier this week, we had a jump of 5 cases in La Crosse County. So we had a significant amount of time where we had not had any cases. I think 13 days, maybe almost a 14-day period. Then we had a couple trickle in, and then we had 5 that came in 1 day. We have an additional 2 that have come in this morning. So we are up to a total of 42 cases. And not very long ago, we were in the lower 30s. So it can really change quickly. And a note here that we have not yet had a testing event in our county where we expect to see additional positive cases. So because of those cases, and again, this is comparing the current 2-week period to the past 2-week period, we have not met this metric because we actually have increased by about 267%. And we're looking to decrease by 10%. So we have not met this metric. The second metric that we look at is the doubling time of 6 days or more. And this is a statement that comes directly out of appropriate resources. We particularly really like using, of course, things like CDC and Department of Health Services guidance, but this one comes out of Prevent Epidemics. And I like that resource because it helps us recognize that we are likely to have multiple peaks of activity in this virus. And we need to be flexible and think beyond just the current peak that we're in. We don't know exactly where in this peak we are. We don't know how long this peak will last, how severe it will be. But right now, I think we're very focused on just wondering what to do as we may come out of this peak in the coming month or couple of months. But I think what we also need to be aware of is that there are likely to be multiple peaks. And we don't know if the current peak that we're in is going to be the lowest peak or the highest peak. We don't know how long we'll be between peaks. So there are a lot of unknowns with this virus that we will only learn through data over time, particularly testing and research that helps us see things like, do we gain immunity from having this virus? If we have a case, does that mean we will be immune and we won't get it again in the future? We don't know that. Will this increase in the same time period as the fall flu season? We don't know that. Will this virus decrease during the summer months like influenza does? We don't know that. So there are a number of things we don't know that we need to be continuing to look at the data to tell us. So in terms of the doubling time of 6 days or more, we have met this metric. Our current doubling time is 40 days. So that means that we are not doubling our case numbers quickly, which is good. The third metric is to observe less than 10% of test results being positive. And we have met this metric. We have talked about this almost every time that I have done a media briefing. I look at this percentage for the state as well as for La Crosse County. And the state has typically been between 8 and 10% of their total tests being positive. And ours has typically been anywhere between slightly less than 1% to about 2% at its highest. So we have routinely been and consistently been lower than the state on this particular measure. And I've talked in the past about why that is, but I will go on record to say, I think a significant reason why we don't have more activity in La Crosse County than we already have is because of the timing of when the Safer at Home order took place initially. We have a chart that shows the date that took place, that order went into effect initially, not the extension, but the initial order. And we can see that the rate of cases compared to the state, La Crosse County's rate was significantly lower starting at that date. So we know that helped decrease our congregating with others, our travel outside of La Crosse County. Travel is and was and will be in the future a significant risk to bringing in the virus from outside areas. The fourth metric that we look at under the epidemiology category of data is to ensure that daily testing is at least 75% the number that is needed for surveillance. So this comes back to what number is the right number for surveillance. And if we go with what the state has laid out in the Badger Bounce Back Plan for their goal for testing across the state. That is 85,000 tests per week. When we reduce that to a daily amount, that shows us that we are at they are asking for us to have 209 tests per 100,000 population. Since La Crosse County's population is about 118,000, that really is about 247 tests per day in La Crosse County that we would like to be doing. We are not near that. We are currently at about 28% of the 75% goal for surveillance testing. So we have a gap at the present time of about 177 tests per day that we really would like to be doing to know as much as we can about this virus. So that is a significant gap. And again, that metric is to ensure daily testing is at least 75% of the number needed for state for surveillance as identified by the state. So that is a big gap. I would like to talk about that gap. So we are very fortunate to have two of the best health systems right here in our own county, and they are doing a lot of great work when it comes to testing. In fact, they have increased their testing capacity by 40% over the past couple of weeks. So we are really grateful to them. But because this gap in testing is so big right now, and because the time frame for individuals to know what to do and to, I think there's this patience level that many of us, including myself, have struggled with. These are very difficult behavior changes we've been asking of all of you, as well as myself. I lead by example. That I think it is difficult to continue to be that patient. And so because of that, we feel like we want to increase testing faster than we currently are. That is a significant reason as to why we submitted an application to the National Guard for testing. And we did just hear late yesterday, early evening actually, that National Guard testing site was approved. So I will tell you about that testing site now. We will have this testing site take place next Thursday, May 21st, from 11 to 7, and it will be held at the Omni Center in Onalaska. There will be more details to come. We will put out a press release about that. We will share all of those details, including who should come to the site and all of that. But I wanted you to know that that site was approved, and I think that will be an important first step to continuing to increase the number of testing. So again, we have had healthcare capacity increasing. We bring in a National Guard testing site to increase. Please recognize that already this week, we've had 7 new cases, and we haven't yet had this testing site. And that testing site, we anticipate, will bring in additional positive cases. Our primary goal in that testing site is to test anyone with symptoms. So I think what's important to note is that many individuals that we've talked to who have been diagnosed with COVID-19, their symptoms have started out very mild, to include, I thought I just had allergies. It felt just like a minor congestion. So it is very minor, and we need to be quickly catching that in ourselves because we may not know that we have COVID-19. I think that's concerning to me, and I think it should be concerning to all of us, and is, again, one of the reasons why I ask what I ask of all of you, and I'll get to those in a little bit. We know that there are individuals that do not show any symptoms at all. We know that many individuals have very minor symptoms, but for those individuals that have severe symptoms, to include requiring hospitalization and death, we do not want that to be happening in our community. And the way that this virus spreads is by droplets. When someone is infected, may or may not know it, and spreads it to someone else, who spreads it to someone else. And the individual who may not have the immune system function to fight it off effectively, or has underlying health conditions, which many of them so far in our data have been individuals under 60. And we know that those over 60 are also at risk. we need to learn more about this virus and how it is impacting our residents right now in La Crosse County. So this testing event, as I said, is just one of the steps to increase testing. We fully anticipate that the healthcare systems will continue to ramp up, that we will very likely apply for another testing site from the National Guard. It is our goal to get as much testing as we can to reach this metric of having at least 75% of the number needed for surveillance. So finally, I go to my call for action. So really, I want to stress that this is a time of unity. So we are not under an order at the present time. That does not mean that we do nothing different. That doesn't mean that we go back to pre-COVID-19 days, that we just stop doing all of the behaviors that we already have been doing. We know that over 70% of our communities and individuals in our communities across this state supported the safer at home order, whether you did or didn't. I think the behavior changes that we ask you to make here are so critical because what you do or don't do will impact lives. So this is a time for unity. We need to work together to protect ourselves, our loved ones, our family members, our friends and neighbors. Thousands, over 10,900 people in the state of Wisconsin have contracted COVID-19 already. Thousands, over 1,900 individuals in our state have required hospitalization, and hundreds, over 420 individuals in our state have died from COVID-19. We currently have 42 cases in La Crosse County as of this morning. We have one individual who has required hospitalization. We hope to have no one in our county die from COVID-19, and that will take a unified effort. As I have said before, it is important to understand how this virus spreads. COVID-19 is a virus that spreads through droplets. So these are droplets that come out of your airway through your mouth and nose as you talk, breathe, sing, cough, other things like that. And we can, whether we know it or not, we can infect others if we are infected, and we may not have symptoms. This virus is not political. It does not care who it infects. And we really must use the tools that we have available to us to minimize the spread of this virus and the disease and destruction and death that it can cause in our county residents. So as the health officer and director for the La Crosse County Health Department, I really urge all businesses, customers of businesses, residents in our communities, everyone to do their part to include all of the following. Number one, stay home if you are sick. Even if you have mild symptoms, that very well could be COVID-19, and we ask you to stay home. Number two, minimize close physical contact with those outside of your household. We understand there may be times when you need to go outside of your household. We're not asking you to always stay in your house, but the close contact within 6 feet is one way that we know that this virus can spread. So we ask you to minimize that close physical contact with others outside your household. Number three, absolutely minimize travel, especially to areas that are considered viral hotspots, both within our state and outside of our state. We live on the border of other states, and I recently was looking at projections of deaths in states around us compared to Wisconsin. Our projections of deaths are lowest compared to Minnesota, Iowa, Illinois. So if we are traveling to those other states and we don't need to be doing that, we risk bringing the virus back to others in our communities. And I urge you to not travel if you don't need to. I think travel is a significant risk and one we should be very, very careful with. Number four, wear a fabric face covering if you must be in public. The reason for this, again, is because you may be infected and not know it. You may not have symptoms. And when you wear the fabric face covering, it prevents the potential that you could expose others. I have heard some stories, and I don't know if they're true, but we just have to be kind to others. I think now is not the time to be to be doing things that are not out of kindness. This is a difficult time for many in our communities, and we just have to remember that we can prevent the spread of this virus by the actions that we do or do not take. Number 5, maintain 6-foot distances with others whenever possible. Number 6, minimize congregating in groups of any size. So we know that there are, we can have a number of 5 individuals prior to the Supreme Court order ruling in a retail location. In some of these stores, we can have a certain percentage of capacity in larger box stores. Now that the orders are not in place, it is up to these businesses to decide what they feel is the best to protect their workforce as well as their customers. And again, congregating, particularly any potential for individuals to be in close physical contact with others, is a way that this virus spreads. And we ask you to minimize congregating in groups. I think about events as well. And when we do, things like birthday parties and funerals and weddings and, musical events and entertainment of other kinds, those can all create an environment where the virus can spread more easily. Again, this is about a battle with a virus, not with each other. And I am determined for La Crosse County residents to come out ahead of this virus and not let it beat us. Number 7, wash your hands frequently with soap and water. This is because you can get contaminated surfaces that you touch, and that puts the contamination on your hands. There is evidence to show that if you then have that on your hand, and if you don't wash your hands frequently, or number 8, avoid touching your face. If you touch your face, you can contaminate yourself with the droplets that sat on a surface. If it is still viable virus, you can contaminate yourself. So those are the 8 asks that I make of you. They're not significantly different than all of the time in the past. And whether or not we're under an order, we know that we need to do these actions in order to prevent the spread of this virus. So businesses, I would really ask you to consider taking action to protect your workforce and customers. We would ask that you follow the guidance that we've provided, the business toolkit on our website, as well as the Wisconsin Economic Development Corporation's website has really good guidance to help provide all of the tools that businesses need in order to prevent the spread of this virus in their business locations. And just because the order is lifted, if you are not currently open and you want to be open, that doesn't mean that you have to go quickly. I suggest that you make sure you review these materials, that you are fully prepared and ready so that you protect your workforce, your employees, and your customers when they are coming into your store. La Crosse County government does intend to lead by example. They will not open the buildings until it is safe to do so. We are using the data to identify this, and we ask others to join us in waiting for the data to guide our decisions and fully adopting all of these recommendations in the meantime. We will not open until we can protect our workforce and the public. We strongly encourage all businesses, churches, events, and others to do the same. And lastly, again, we do not need an order to know what to do. We should not need an order to require that we do the right thing. We need to choose to protect ourselves and each other, and thereby protect our community and our economy. And this is by changing our behavior in accordance with the recommendations that I have listed out. So this is all that I currently have to share with you. I hope that this information has been valuable and helpful. I really want you to understand the data and the reasons that we make these asks. And while we aren't currently issuing an order, we are very strongly asking you to take these recommendations and implement them at your place of business, in your community, in your household, in all locations across our county, because in doing so, we will prevent the spread of COVID-19. At this time, I will take questions from our media partners.
Go ahead, Mal from WKBT.
Yes, this is Mal Meyer with News 8 Now. I'm wondering if you have been in talks with other counties about their plans. Are you trying to take a unified approach to keep guidance similar among our neighboring counties? I'm thinking specifically of Trempealeau, Monroe, Vernon counties, just to name a few.
Yes, thank you, Mal, for this question. We are very connected in the counties surrounding us. I have both been already this morning in conversation with our State Association of Health Officers, which included health officers from across the state in that call this morning. I also met with all of the counties around us: Buffalo, Trempealeau, Jackson, Monroe, Vernon, and Crawford counties in Wisconsin. And we all have individual county systems that we need to go through in order to determine the best course of action. I have absolutely shared my statement with them. I have allowed them to consider any or all of it that may be beneficial for their own counties. They are all currently working to figure out the best action for their counties. And I know that this is something that many counties, probably all health officers across the state, are looking at the Supreme Court decision, deciding what action is best for their county, and then developing a plan to move forward. So yes, I think that the counties around us are currently in consideration about what their action will be. We have discussed it, and we will certainly support each other's decisions.
Go ahead, Emily from La Crosse Tribune.
Hi, was this something that you expected to happen, the overturning, or did this come as a surprise to the health department last night?
Yeah, thanks, Emily, for this question. We have been watching this closely and have talked about it on media briefings. In fact, you may recall in the media briefing on Tuesday that I already made this statement that, doesn't matter what the Supreme Court does, that we know what to do and that our actions should not change. And this statement essentially directly supports that. So yes, we did anticipate that there would likely be an overturn of the order. And we did have some time to think about what we might do. I do think that there was a big question, however, that we would not have gotten and did not get until the order actually came out, the decision actually came out, was about what the decision was held on. And I think, particularly there is state statute around health officer authority under Chapter 252 that says that health officers have the authority to take the actions that are reasonable and necessary to prevent the spread of disease in their communities. And so we needed to wait to see what the Supreme Court ruling language was. And I think that many counties are still working to understand that, as are we, continuing to review that and determine what next steps we might be interested in taking. So I would say that, this statement is the first step, and we do need to provide additional guidance to our residents, and we'll be working on that in terms of where do we go from here? How do we know, if you still don't feel comfortable opening, we completely understand that. If you still don't feel comfortable going out in the community to shop, we completely understand that. The data supports that. And we will continue to share the data and recommended actions as we go forward. There is this Badger bounce back plan and framework with moving from the safer at home order to the phase 1 and phase 2. I don't know how applicable that will remain, and we will have to continue to monitor this and plan for how to make sure that our residents and businesses and others in our communities have enough information to make decisions. And that would be our goal.
Hi, Jen. Marcus Arsvold with News 19. Why did La Crosse County decide not to take the same measures that Dane County did in Madison?
So why we did not decide to do the same as Dane County, there are a number of options that are available to us. One of them is to just take all of the language in the Safer at Home order and write that into a health order underneath the statutory authority that health officers receive through Chapter 252. Another option was what Dane County did, was just kind of identify the executive orders that they were adopting within their health order. I think that that is certainly a decision they can make. It's a decision we considered. I think that we are not fully in support of that for La Crosse County right now. And that could change. But I would say that ultimately, having an order or not having an order, there are unintended consequences of placing an order across everyone in our county. And I think that what we need to do is we need to see if everyone in our county can follow the recommended guidelines outside of an order. And I think this is the time for that unified approach. It doesn't mean that we won't do an order in the future, but right now we think that this statement identifying that what the data is, where we're really at, that we are not ready to be completely reopened, and that we need to be following a certain set of actions in order to decrease the spread of this virus. That is the best action that we believe in right now.
Hey, Jen, this is Caitlin with Wisdom. Was the anticipation of the Supreme Court's decision a factor in why we applied for the National Guard testing site?
That's a good question, Caitlin. No, I would say that Supreme Court order was not a factor. The decision to go with a National Guard testing site was solely based on the data. And that data, as I mentioned, explicitly identifies a significant gap in where we need to be with testing that we aren't able to quickly fill, and we need additional assistance. And that I believe it is important to bring in those resources that are currently available to us to meet that goal and to help our county residents see what additional information we learn out of that testing.
Go ahead, Emily from La Crosse Tribune. Emily from La Crosse Tribune.
Hi. I believe that events like Riverfest and graduations could resume now if they choose to do so. Is that correct?
Yeah, so along with questions of any kind along this sort, can my business reopen? Can I have my graduation party now? Can I do this event with lots of people now? My answer would be there's not an order that will enforce you or will force you to not be able to do that. But I would ask you to consider the data and the facts around this virus, and knowing that congregating individuals often results in high-risk situations for this virus to spread. So we know that this virus spreads when you have close contact within 6 feet of others. I have been to many events and graduation parties and others, and I believe that unless they are done extremely carefully, those will result in high-risk situations for this virus to spread.
Jen, we have a question from Jillian from the Crawford County Independent. They are wondering when the National Guard does the testing site, will people outside of La Crosse County be able to be tested, or other residents outside of La Crosse County?
Yeah, thank you for that question. In terms of who can come to the testing site, there are no residency requirements. We are checking with the National Guard since it is a Wisconsin resource. We aren't sure about folks like Houston County residents or others outside of La Crosse County. We are verifying that, but there are no residency requirements.
Go ahead, Mal.
Yep, this is Mal Meyer with News 8 Now again. I'm just wondering, how many tests do you anticipate to complete during the National Guard testing? Have they given you those details? I know the one in Buffalo County that was held up a few weeks ago, they only had about 200 tests, and that sounds like that's even below where you would like to be for our daily testing.
Yeah, thanks, Mal. And I know you covered it up there in Buffalo County. I used to work in Buffalo County. I was proud to see that they had a testing site. I think that was important for their residents. The number of test kits that we have asked the National Guard to bring for this testing site is the maximum number. And because they have gotten better at this testing process and can do it more quickly, that number is 400 test kits.
Do we have any other questions for Jen today? Go ahead, Marcus.
Marcus with News 19. Yeah, Jen, how similar do you think your plan will?
Sorry about that, Marcus. Go ahead.
That's okay. How similar do you think your plan will be during this reopen process to the Badger bounce back plan that was installed?
That's a very good question, Marcus. How similar? So we have been looking at, and we have some critiques of the Badger bounce back plan. In particular, it does not recognize that there will be times where we are moving into another peak and need to tighten, or however you want to, whatever analogy you want to use, sort of close that dial instead of open the dial. That plan does not recognize that fact. But in the short term, it does have some good information, although it does lack detail, and we'd like to support that need for detail. It does provide some general guidance around what can happen in each of the phases. And I think what the plan does is state we cannot go from 0 to 60 in terms of nothing is open to everything is open, especially considering our local data, not state data. Our local data strongly tells us that we're not ready for that to happen. So now we have to put the onus on our residents and our business owners and our church leaders and others in our communities to make the right decisions based upon the data. And we will do our best to help you all through that. But that does not mean, we just widely open and we do nothing different. It means we have to carefully consider the actions that we must take to protect those that are coming to our businesses or our buildings or our customers, as well as the people who are working for us. And those include everything from assuring that people can physical distance as best as possible based upon the way the facility is laid out. It includes considerations about decreasing the number of people in a location in order to decrease that potential for close physical contact. It can include encouraging or even requiring that individuals who work for you or come to your facility are wearing fabric face coverings. So businesses and others have a lot of power that we would ask you to now really strongly consider in terms of assuring that this virus does not ramp up and really cause devastation across our communities in terms of severe disease and death. So I think it really does come back to the guidance documents that we already have in place. There is a lot out there for resources to assist you all with planning and making sure you're ready when you do decide to open. But again, we do support a phased approach to opening. We don't think that we must have an order to know what to do. But as we continue forward, we will continue to monitor this. And if we need a specific order to assure that we can protect our residents, we will definitely consider doing that.
Hey, this is Mal Meyer with News 8 Now. I'm wondering if there's any indication that large gatherings are already linked to local cases in our county. I know that there was previous reporting earlier this week or a few days ago that some people had, when questioned by health officials, said that they had attended a large gathering previous to when they think they might have had it or came in contact with it. So is there any indication right now that any large gatherings are linked to these local cases?
Yeah, thanks, Mal. I'm thinking through the cases that we have had, and I cannot come up with one that I can attribute to a large gathering. We have not had a lot of large gatherings. Predominantly, our county has done the right thing so far, and I have hope that we can continue to do that. Large gatherings are not a good idea, and they are very difficult to do safely enough. So I truly do discourage them. I think I know that it's difficult when you want to gather with others for a wedding or a funeral or an entertainment event, but this is about a virus that we can't see. We don't exactly know where it is, and we are at war with this virus, and we must take all precautions to not allow it to continue to spread across our community in individuals who live and work here.
Emily Pyrick, La Crosse Tribune. Could you give specific reasons why you felt it wasn't the best decision to maintain the order's decision here? I know you provided guidelines, but what were the exact reasons that you felt that it wasn't, pertinent to completely not follow that?
Yeah, thanks, Emily. So in terms of exact reasons, there are a number of considerations that we have a team of us here have looked at to try to make the best decision that we can. There are many considerations. One being the ruling itself and the language behind the Safer at Home order. One being the authority and the language in Chapter 252. And what does reasonable and necessary, doing what is reasonable and necessary to prevent the spread of disease in our communities mean? How broad can that be applied? How broad should that be applied? It is a balance always between lives and livelihood. And, I think that there are unintended consequences of any decision that is made. So it is fairly heartbreaking, honestly, to have to make that decision. As I've always said, my goal is always to do what I think is the right decision at the time. And I think we have a lot of power in our residents and business owners, and we count on you to do the right thing. And if we cannot maintain under this time where we know we need to be increasing testing, then we will see an increase of cases, and we will continue on a daily basis to talk about and weigh out the data and the aspects that we have available to us. And at any time, if we feel like an order is necessary, that is subject to change. So I think that when you say what are the exact reasons, there are many of them on both sides of that decision. It is not an easy decision to make, but a blanket order over everyone, and especially the Safer at Home order, there are lots of challenges with that order because it has sort of come out in multiple phases. And there are just strange things about that. And that is how policy can work sometimes. But if we do an order, it will not be a blanket adoption of the Safer at Home order.
Yes, this is Mal with News 8 Now. I'm just wondering if you're prepared to increase contact tracing as businesses are reopening, as they're letting more people come inside their businesses. This even before the Safer at Home order was deemed not enforceable. Businesses were already opening up to maybe 5 people or less. Are you ready for that kind of increased contact tracing where it might become more difficult to know who is in exact places at any given time?
Yeah, thanks, Mal. That is a significant area that I watch very closely. As I've talked about, what our goals are is that we want to prevent cases in the first place. And that's where all of you come into play with taking the behaviors and actions and recommendations and really maximizing the use of those. But then in the health department and our contact tracing and disease investigation teams, the goal there is once someone has COVID-19, our goal is to try to decrease the number of people they spread it to. Obviously, not ever intentionally, but again, that does take a lot of time. The more that people congregate, the more contacts someone has, the more difficult and time-consuming that process gets. So there are a lot of pieces that go into knowing for sure how many contact tracers you really need. And we are currently both at the county level and at the state level. I'm part of a contact tracing advisory team that is part of the State Emergency Operations Center or overall incident command system responding to this virus. And as part of that team, the state is hiring individuals. We're talking right now about how to get those individuals connected to health departments to assist with contact tracing so that they are part of our teams, because we can't just take someone who's hired at the state and lives in Madison and has never been in La Crosse County and isn't part of our team. They can't just jump in and be a good contact tracer. So the quality of that work is also important. Right now, Mal, we are able to function. We have a core group and a backup team. But I will tell you that right now, that core group and backup team are fully engaged. So we got 5 cases on Tuesday. We got 2 more cases today. We expect we may get more cases. We have folks being tested. We haven't yet gotten to the testing event. So we are really right now looking at how we can increase the number of contact tracers, because we do expect we will need more.
Jen, we have a question from Facebook wondering if businesses don't follow health department guidelines, is there any recourse for that?
Yeah, so if businesses choose not to follow guidelines, there is no order in place at the state level, and law enforcement has nothing to enforce. So in terms of recourse, there is no ability to enforce when there isn't an order in place. But that being said, if that becomes highly problematic, I will be watching that very closely and will be in communication with my team to include law enforcement partners and others. And if we have a problem that we need to solve in order to reduce the spread of disease in our communities, we will take action. We must do what is reasonable and necessary to prevent disease. So I cannot stress enough, whether there is or isn't a recourse, the recourse is devastation from the disease. So maybe you don't get fined, or you don't have to, you don't have to talk to law enforcement or the DA's office, but what you do can impact the lives of individuals in this community. And I don't think any business owner has an intention to negatively impact lives. So I think the recourse is not from enforcement; it's from the virus itself.
Any other questions today? I'm not seeing any other questions, Jen.
Okay, thank you all for joining us for this emergency media briefing. We appreciate you being here. We want to be here for you. We ask that you do the right thing. Many of you have already been doing that. Please continue to do that. Again, just because this order is not there does not mean that we change our behaviors. We know what to do. We know how to decrease the spread of this virus. We have to do it, and we have to consistently do those behavior changes to protect ourselves and each other in this community from this virus that we cannot see. So thank you for your time. We will continue our normal media briefing schedule, which means that we will be here with you tomorrow on Friday at 2:30. Thank you and have a great rest of your day.